Hello, everybody. My name is Michel Delforge. I'm a clinical hematologist working at University of Leuven in Belgium. And I want to thank the organizers for allowing me to present our poster, which is entitled Patient-Reported Outcomes in Triple-Class Exposed Relapsed Refractory Multiple Myeloma Patients in the KarMMa-3 Trial. And I'm presenting the data on behalf of my co-authors. Now, to start with the introduction, I think it's well known that patients with triple-class exposed multiple myeloma, frequently also triple-class refractory patients, have a poor quality of life. Now, in the KarMMa study, Ide-cel, as with other BCMA-targeting CAR T-cells, have shown unprecedented response rates and progression-free survival rates. Now, KarMMa-3 study is an open-label phase 3 randomized controlled trial enrolling patients with relapsed refractory multiple myeloma who were triple-class exposed and who had received between 2 to 4 prior regimens. Now, regarding efficacy, it was published that the median progression-free survival with Ide-cel was significantly longer, 13.3 months, compared to only 4.4 months in the drug-based regimen. Now, the objective of this sub-analysis was to compare patient-reported outcome in those treated with Ide-cel versus the standard regimens. And PROs included overall changes over time, and we used several HRQoL scores to address this. Now, at the bottom of the slide here, you see that, and I'll show you in a moment the figure, that we use several instruments to evaluate quality of life, like the EORTC QLK-C30 questionnaire, the EORTC multiple myeloma module, which is also referred to as QLQ-MY20, and the HRQoL 5-dimension 5-level or AQ5D5L health utility index. And we assessed in these quality of life scores the most important and relevant domains. Here you see the design of the study. So as mentioned, it was a phase 3 randomized study where patients were randomized in a 2-to-1 setting to either Ide-cel or a standard regimen. Now, patients who were enrolled in the Ide-cel arm had to go through leukapheresis, and then there was, of course, the time for the manufacturing of the CAR T-cells. So you see that PRO was evaluated just at baseline, and then just post-leukapheresis, and then on day 1 of the infusion. And subsequently, it was measured monthly for the first 2 years, followed by every 3 months later on. And for the standard regimens, since these regimens are given on a monthly basis, the PRO was also measured monthly for the first 2 years, followed by an assessment every 3 months. I will skip the statistical plan, but just to show you here that in terms of patient characteristics, both arms were very well balanced in terms of patient and disease-related parameters. And importantly, as already mentioned, those patients unfortunately have a quality of life that is inferior compared to an age-matched healthy population. Now, overall, we wanted to see the quality of life at different time points, but also to assess the evolution from the health-related quality of life parameters over time. On this figure, you see the most important health-related quality of life domains. And what we show here is that Ide-cel showed a significant and clinically meaningful improvement in those health-related quality of life domains compared with the standard regimens. So on top, you see the global health status, which here is the orange line, and which rapidly becomes superior compared to the control arm, and importantly, it stays above the global health status of patients that received standard of care treatment. The same for the physical function, according also to QLQ-C30, and for cognitive functioning. Very importantly, we saw in the Ide-cel arm a very rapid and profound and sustained improvement in important symptom burden. Here you see the improvement in fatigue, and you see also here the improvement in pain, which is also in particular related to the prompt and sustained control over the disease. Here you see that higher is worsening and lower is improvement. You see here also that there was a rapid decrease in the myeloma-related disease symptoms. And when it comes to side effects of treatment, there is a little increase, but very temporarily in the beginning, which can be related to the immediate side effects of CAR T-cell infusion. But shortly thereafter, we see that there is a significant and clinically meaningful improvement in the side effects of the treatment, because basically it is only a one-time cell infusion. Similarly, we see an improvement in the EQ-5D-5L health utility index. So here you see a kind of a summary of the least square mean changes from baseline to 20 months. And we see all this in the functional domains favors Ide-cel, and in the symptom domains, it also favors Ide-cel because they are reduced compared to the standard regimens. So in conclusion, I hope I have shown you that Ide-cel showed significant and clinically meaningful improvements in health-related quality of life compared with standard regimens, including key myeloma symptoms and functioning domains for patients in a difficult-to-treat triple-class exposed relapsed refractory myeloma population, with faster improvements and delayed worsening in many domains. KarMMa-3 baseline PRO results were comparable between the two treatment arms and worse for both arms than in the European general populations. Difference in overall least square mean changes from baseline reached or exceeded the pre-specified mid-thresholds for most domains in favor of Ide-cel. Ide-cel is the first chimeric antigen receptor T-cell therapy for relapsed refractory multiple myeloma to demonstrate improved PROs versus standard regimens in a phase 3 randomized controlled study. These findings expand upon the clinical benefits of Ide-cel versus standard regimens observed in the KarMMa-3 trial, demonstrating that Ide-cel offers a longer PFS associated with improved health-related quality of life for the treated patients. And I want to close by thanking again all the co-authors who have made this possible, together, of course, with the patients and their families. Thank you for your attention.